Okay, hi, good morning. We're right on time, 9:06. On first dimming time, that is. Welcome. I'm so excited to have the opportunity to speak with you this morning in collaboration with my dear friend and colleague, Amber McCarthy, who is sitting in the front row. Amber is a superhuman. She is the social worker in our clinic, and we're so grateful that she's here. We were laughing last night. I'm like, if we stand side by side, I mean, we could do I could ask you guys, give you a little quiz, like, which of us do you think is the anxious type? And it would take about 4 seconds for you to figure that out. I'm like, what do you think? And Amber's like, it's good, we've got it. Yeah. I love it. She's my emotional support social worker. Yeah, she just exudes serenity. So I always try to channel my inner Amber, and I'm successful 54% of the time, at best. So we're going to talk about anxiety. We'll talk about anxiety and HD, and then we'll talk about general anxiety. And so I'll be a little bit of a talking head this morning. I have some slides that I'll go through and that hopefully won't be too painful. And then towards the end of the presentation, since we do have a good bit of time together this morning, for better or for worse, we'll have Amber come up and really make the world a better place and talk us through a meditation session and hopefully eliminate or minimize our anxiety. So let's get started. This is the little QR code. If you want to scan this QR code and then give us some feedback, only positive feedback is accepted, but please feel free, okay? So our agenda, like I said, we're going to talk about anxiety, and we'll talk about general anxiety disorders, and then anxiety and HD. We'll talk through a few cases, so that just to keep us awake, we'll see a few patients in clinic, and then most importantly, we'll focus on treatment. So let's start with the basics. What is anxiety? As you all, I'm sure, know, anxiety is apprehension, tension, or uneasiness that stems from the anticipation of danger, which may be internal or external. Is anxiety normal? I mean, that's assuming any of us are actually normal, which we're obviously not, or I'm not. But is anxiety considered normal? Well, yes, at times it can be considered normal. Fear and anxiety can facilitate survival and may be adaptive. So we need to feel anxious at times. If a bear is chasing us, we need to feel anxious and start running, hopefully, as opposed to freezing. So like I said, many fears and anxieties are considered normal. For example, during childhood, stranger anxiety is normal and protective. In adulthood, major life stressors can provoke anxiety. Receiving an HD diagnosis can provoke anxiety. Considering predictive gene testing for HD can provoke anxiety. Living through a pandemic, can you imagine? Can provoke anxiety. We know that there are various neural pathways, there are various areas in the brain that are important when it comes to our response to anxiety. And so you see, I don't have a pointer, but you see the areas, they're color-coded, various areas within the brain that are really important in our response to anxieties, whether they're sort of distant predators, anxiety that's approaching, or a painful stimuli. So some anxiety, like I said, is normal and actually protective, but not all anxiety is considered within normal limits. So if anxiety is intense, if it's excessive, and if it's persistent, and really disproportionate to a threat, then we need to think about treatments. If anxiety is disrupting normal function, we need to think about addressing the anxiety. The good news is we do have effective treatments, and I'll say that many times today. So how do we clinically evaluate anxiety? First things first, we take a history. We ask our patients how they're feeling. There are formal, structured interviews just focused on anxiety disorders, so we can ask our patients questions, and that's really how we make a diagnosis. We don't have biomarkers. I can't send my patient to the lab and say, Do you have the anxiety marker? It's not that easy. We really have to talk to our patients, ask our patients questions. We have various scales that we can implement to help us determine the severity of anxiety. These are a few examples. Here it's a little blurry, I apologize, but this is an example of the GAD-7, the Generalized Anxiety Disorder 7. Some of you may have filled this out in a clinic. It really just helps you define the severity of your anxiety, if in fact you're experiencing anxiety. So scales are very helpful, but at the end of the day, I think just communicating with our patients, most importantly, listening to our patients, can help us determine if we're in fact dealing with problematic anxiety. So what are anxiety disorders? Anxiety disorders are a group of disorders in which anxiety is the major element. The core features include excessive fear and anxiety with avoidance to perceived threats that are persistent and impair function. So I've said that already. So severe anxiety that really negatively impacts your ability to function from day to day. We know that genetics, environment, neurologic conditions like HD, and other medical conditions can increase the risk of an anxiety disorder. Anxiety disorders, interestingly, are the most prevalent group of psychiatric disorders, so very common. Up to 30% of adults may experience some degree of anxiety throughout their lifetime, more common in women than in men, and anxiety may occur in up to 70% of individuals with HD at some point throughout their HD journey. But most importantly, as I've said already, anxiety is treatable. So what are the common symptoms that individuals may have? Well, we know that there are core emotional and cognitive features. So I've already mentioned this, marked excessive anxiety, got that. Physical symptoms are often common, not surprising. Individuals that are anxious can feel restless. They can have a tough time kind of just settling down. This is me. Here's Amber. There's your example. Restlessness, even fatigue, irritability. Folks that have anxiety disorders can have a really tough time concentrating and staying on task. Sleep disturbances are incredibly common. There are also behavioral symptoms that are common in individuals with anxiety disorders. Most individuals will avoid situations that provoke anxiety. The anxiety, like I said, can interfere with daily activities and productivity and just daily functioning in general. So anxiety disorders can cause individuals to avoid situations, like I said, that trigger or worsen their symptoms. And really, in general, for an individual to be diagnosed with an anxiety disorder, the fear or anxiety must be out of proportion to the situation. So we are all entitled to a little anxiety. Like I mentioned previously, anxiety can be adaptive, it can be protective, but if the anxiety is severe and negatively impacting function, then we may be dealing with an anxiety disorder. How do we classify anxiety disorders? Well, using the DSM-5, which you may have heard about, or the ICD-11. The categorical diagnostic criteria are clinically useful. However, the boundaries between anxiety disorders and normative anxiety are often ill-defined. It's often not quite as clear-cut as we would like it to be. As I like to say to my patients, not all of my patients read the textbooks before coming in to see us. Not everything is black and white. There's often the lines are blurred. So the recognition of distinctions requires clinical judgment of the severity, the duration, the persistence, and really the degree of distress or impairment that the anxiety is causing. At the end of the day, even if anxiety does not fulfill the diagnostic criteria for an anxiety disorder, it should still be acknowledged and addressed if bothersome. So, what are I talked about the classification schemes. What are the anxiety disorders? And the categories have changed, have evolved over the years. The first three are usually the onset is in childhood. Separation anxiety, selective mutism, and specific phobias. And then the last four usually begin in adulthood. Of course, there are exceptions to all of these, but generalized anxiety disorder, social anxiety disorder, panic disorder, and agoraphobia. I'm going to talk through briefly, just define those that begin during adulthood. So, general anxiety disorder usually begins about during adulthood. The average age of onset is about 30 years of age. And the anxiety is persistent. It needs to be present for greater than 6 months, and it really is difficult to control. The anxiety causes significant distress and an impairment in function, as we've already said. Panic disorder is a disorder in which individuals have recurrent panic attacks. And the panic attacks are persistent. They occur for more than 1 month in duration. What is a panic attack? I suspect most of you are familiar with the definition of a panic attack. They're uncomfortable for individuals. They're scary for individuals. Individuals that experience panic attacks often think they're having a heart attack. They feel nauseous, they have palpitations, they're sweating, they may have abdominal pain. They just feel terrible. Panic attacks occur, usually the onset is fairly rapid. The effect of the anxiety, the panic attack occurs within 10 minutes, and they can last up to 30 minutes. So many individuals, especially upon experiencing their initial panic attack, will head to the ER again, thinking that something is terribly wrong, and of course there is, but usually it's not a myocardial infarction or a heart attack, it's actually a panic attack. So, specific phobia. A specific phobia is excessive and persistent fear of an object, situation, or activity that is generally not harmful. So individuals that have a specific phobia know that their fear is excessive, but they just can't overcome it. The fears cause distress, and some people go to extreme lengths to avoid the object that they fear. So examples may be public speaking, and here I am, standing here, still standing, yay, haven't passed out, haven't fled the scene, fear of spiders, which my son has. But importantly, this fear really needs to be problematic and it needs to be persistent for more than 6 months in duration. Agoraphobia, you guys have probably heard of agoraphobia. Agoraphobia is a fear of being in situations where escape may be difficult or embarrassing, or help might not be readily available. The fear is out of proportion to the actual situation, and again, we've heard this before, impairs function. So, an individual with agoraphobia experiences this fear in 2 or more of the following situations, maybe using public transportation, being in open spaces, even being in enclosed spaces, standing in line, or being in a crowd. The symptoms, again, you now see a pattern here, need to be present for greater than 6 months. So this is not something that happens once every 10 years. These are really bothersome symptoms that are persistent. Finally, social anxiety disorder. Individuals with social anxiety disorder have significant anxiety and discomfort about being embarrassed, humiliated, or rejected during social situations. Affected individuals will try to avoid the situation or endure it with great anxiety, and they're really uncomfortable during these situations. Anxiety impairs daily functioning, and the symptoms are present for greater than 6 months. An example would be meeting new people, or eating or drinking in public. Coming to an HDSA convention can be very, very anxiety-provoking and maybe impossible for individuals with social anxiety disorder if it's not treated. So let's talk briefly about anxiety in HD. I've already mentioned that anxiety in HD is very common and can occur in up to 70% of individuals with HD at some point throughout their HD journey. And the symptoms are not surprising, similar to some of the anxiety disorders that I've already described. There can be just general anxiety, just feeling nervous kind of all the time. There can be social anxiety, anticipatory anxiety, even post-traumatic stress disorder. So the anxiety in HD, there can be very, very different for each individual. Often, anxiety in HD coexist with other disorders, such as depression. So anxiety does not like to travel alone. Anxiety brings friends along, like depression, possibly bipolar disorder, or even obsessive-compulsive disorder. So it's, again, often there are many different symptoms that may be present. It may not be clear-cut as to what exactly we're dealing with, but that's okay. We need to ask our patients questions, we need to ask their caregivers questions, and try to determine what the most bothersome symptom is so that we can effectively address it. So factors that may provoke anxiety in HD, these are not surprising. Individuals can have performance anxiety due to cognitive impairments or physical impairments. So as the disease progresses, the anxiety may heighten in various situations in which they need to perform. Unfamiliar situations can provoke anxiety. Changes in routine. We know that structure is incredibly important for our patients living with HD, and it can be very anxiety-provoking to have a change in routine, even if it seems minor, even if we're changing the time of breakfast or lunch. Whoa, that can really throw us off into possibly even a panic attack. I mean, it can be really, really scary, and that is normal. That is normal in HD. Again, normal is always in air quotes with me. I am not normal. Disclaimer. Okay. Physical discomfort. So this is something important to remember as HD progresses, because it may be a little tougher for our patients to effectively express themselves as the disease progresses. And so if they have some element of discomfort, you may just appreciate that they are more anxious, but they may not be able to effectively articulate what they're anxious about, what that discomfort may be. And then if individuals have dysphagia, if they have difficulty with swallowing, or if they're worried about having difficulty with swallowing, meal times can be very anxiety-provoking. And so this gets back to really kind of getting into the weeds with our patients and their care partners and trying to determine if the anxiety is sort of episodic. Is the anxiety present all the time? Are you always feeling nervous and anxious? Or does it sort of come and go? And if it does come and go, when are we noticing that the anxiety is more problematic? And I've definitely worked with folks that have finally determined, it's taken a while, that, hey, I'm feeling far more nervous when I sit down for a meal because, why? Because I'm worried that I might choke. And so we have strategies that we can implement to try to minimize that anxiety. What are some potential anxiety-provoking questions? What are some questions I've heard from my patients that are feeling anxious? What is my gene status? Am I gene positive? Am I gene negative? Should I get tested? I remember visiting, when I started my HD clinic, visiting with one young woman who was pursuing predictive gene testing. She was not symptomatic, but wanted to know if she was gene positive or gene negative. And I naively said, oh, you must think about this, once a week or once a month. And she laughed. She said, are you kidding me? I think about this all day, every day. And so this can be something that our individuals that are at risk think about all the time. And it can be very anxiety-provoking. I am gene positive, but now what? When will I become symptomatic? What's next? I stumbled today. Does that mean I'm now becoming motor manifest? I'm now symptomatic. When will I become symptomatic? And unfortunately, we don't yet have, as you all know, a validated biomarker to say with accuracy, well, next week you'll start manifesting these symptoms, or next month. No. Oh, well, within a decade, you'll likely manifest symptoms, and that's not really helpful when you're trying to plan ahead. It can be very overwhelming to sort of not have control over understanding what the prognosis is, because we know HD is different for everyone, and everyone progresses at their own rate. What if my child is affected? What do we have to expect throughout the HD journey? What is my prognosis? What are my symptoms going to look like? When and how will my loved one live and die with HD? So these are questions that I've heard from many of my patients that can be very anxiety-provoking, and they're absolutely appropriate questions to ask. Unfortunately, we don't have answers or accurate answers for all of these questions, but asking these questions is important, and talking through what we do know and what we don't know is important, so that hopefully our patients feel empowered with understanding the sort of level of knowledge that we have about HD and the progress that we have made and will continue to make in getting us to a hopefully more accurate answers in the relatively near future. So a few other kind of general comments about anxiety in HD. Anxiety can exacerbate chorea in HD, so most of you are familiar with chorea, which is the most common involuntary movement that individuals with adult onset Huntington's disease will experience. And individuals with kind of uncontrolled anxiety or bothersome anxiety, they may have heightened chorea. Anxiety, as I've already mentioned, can disrupt sleep, and sleep is precious, as we all know. Anxiety may manifest as restlessness due to difficulty in verbally communicating distress. And so that's important, as I mentioned earlier, as the disease progresses. If folks are having a little more trouble with their verbal communication, their anxiety may be heightened, and that may manifest as just more restlessness. Anxiety can be confused with akathisia and actually can coexist with akathisia. What is akathisia? Akathisia is it's an increased movement, involuntary movement, due to an inner sense of restlessness. So individuals that have akathisia often are pacing around the room, they're sitting in their chair, they're rocking, so the movements are somewhat stereotyped. Yes, absolutely, individuals with Huntington's-related chorea can sort of pace about, and they have hyperkinetic movements, and they can appear to be rocking in their chair, but they don't have that accompanied inner sense of restlessness. So that's the big differentiating factor, and that's important, and I'll talk about it more in a moment. So the treatment, importantly for anxiety in general, is not HD specific, but at the end of the day, guess what? I've only said it 14 times already, anxiety is treatable. So what are some factors that can cause or exacerbate anxiety? Well, we have to think about other potential contributing factors. So thyroid dysfunction, if you have hyperthyroidism, that can exacerbate anxiety and cause palpitations and sweating and feelings of nervousness. Underlying cardiac or pulmonary disease, excessive caffeine intake, especially those of us that like our coffee in the morning, can enjoy maybe some palpitations for a moment when you're heading to give a talk. Substance abuse can exacerbate anxiety. And then, importantly, and I'll talk about this, I think, on the next slide, medications prescribed to treat the movements, joy, just to make things more exciting and complicated, can exacerbate anxiety. So, how are you feeling? Hopefully not too anxious. You're like, oh my gosh, no, I wasn't anxious when I walked in, and this crazy lady's made me anxious now. Thanks a lot. Okay, so let's talk through a few cases just to keep us awake and alert. Give you some examples of some patients that I've met along the way with anxiety. So our first case is a 58-year-old female who presented to the HD clinic with bothersome chorea. So I've already kind of briefly defined chorea, involuntary movements that flow from one body part to the next, very common in adult onset HD. But like I said already, individuals with HD-related chorea generally do not report an inner sense of restlessness. They have the movements. More often than not, they may not even notice that they have the movements, and that's okay. So the neurologist started a medication to address her chorea. Her chorea was fairly pronounced, and it was in the category of bothersome. She was dropping things frequently and tripping a good bit and knocking things over. And so the neurologist decided to start a medication. And the patient returned for her follow-up visit. The neurologist was patting himself or herself on their back, saying, all right, I treated the chorea. The chorea's gone and did my job. Great. However, dun dun dun, approximately 6 weeks later, the patient returns to clinic with both of her adult children who are incredibly worried and now anxious because their mom is very different. Her chorea is effectively suppressed, so the chorea is better. However, she's pacing around the room, she's rocking in her chair at home, she can't sit down, she's feeling more anxious, things are very different. So she doesn't have chorea, but she's still rocking and pacing and very, very uncomfortable. She's not sleeping well. So the family, rightly so, was very concerned. Something is different with our mom, and this has been really over a very short period of time that things have changed. And we know, as a general rule in HD, changes due purely to HD do not occur from one day to the next. If there are changes that occur from one day to the next, there's something else that we can implicate, okay? So she was diagnosed with iatrogenic akathisia. Fancy terminology there, that just means that it's medication-induced, and akathisia we've already defined, okay? So the medication that she was taking caused akathisia, and unfortunately, like I said, We know that we have lots of medications to address the symptoms of Huntington's disease, and we celebrate that. We love the fact that we can effectively treat the symptoms of HD with pharmacologic and non-pharmacologic therapy, but we have to be respectful of medication side effects. All medications have potential side effects. As long as we talk through those potential side effects, start low and go slow, we can usually stay on top of the side effects, and we can stop a medication if it causes side effects. So we should certainly try medications when we need them, but we have to be respectful of potential side effects. And so her chorea medication was stopped, and her most bothersome symptoms were resolved. And we used a different type of medication to suppress her chorea. Second case. Thank y'all, by the way, for becoming a movement disorder neurologist this morning. So add that to your badge on the way out. Okay, second case. 42-year-old male with HD presents to the clinic reporting a significant increase in his anxiety over the past 2 weeks. Okay, so here's a little bit of a red flag. Things have changed fairly acutely. We were okay, and then a couple of weeks ago, something has changed. Okay, so should we just assume it's HD and say, you're fine, it's HD is progressing, so just run along? Just kind of tell him, don't worry about your worry, you're fine. Or should we increase the dose of medication that he takes for anxiety? Or should we collect more data, ask more questions? Any guesses? See, I told you. Y'all are, congrats. Movement disorder specialist already. Love it. So we collect more data. We ask him more questions. And we determine that he recently started drinking not 1, not 2, not 3, but 4 energy drinks, some sort of, Monster, whatever, energy drinks every morning. Wow, that's a lot. So we say, we think we have an answer. That's the good news. We think we understand your recent increase in anxiety. And we strongly encourage that he decrease his caffeine intake and maybe go back to 1, max 2 energy drinks. And amazingly, he returns to clinic 4 weeks later, and his anxiety has improved. He has returned to his baseline. So, phew. So he improved. Okay, third and final case. We have a 42-year-old female at risk for HD. She presents to the HD clinic to pursue predictive testing. She endorsed, during her predictive testing visit, her initial visit, she endorsed excessive anxiety that was really limiting her productivity at work. She reported always being nervous. She's kind of a nervous type. But due to the pending genetic testing, her anxiety had increased significantly over the past year, and she'd really been unable to sleep, unable to eat, and she just kind of felt like she was falling apart at the seams, mostly due to her anxiety. So she visited with the HD psychiatrist who recommended cognitive behavioral therapy, which we'll talk about in a moment, and a medication, an SSRI. She returned to clinic, and we'll talk about that in a moment too. She returned to clinic 6 weeks later and reported a substantial improvement in her anxiety. So at that time, upon returning to the clinic, she said, you know what, I feel better. The treatment team felt better and decided she was finally ready to pursue predictive genetic testing. And in fact, her gene status was negative. So what did we learn from our 3 cases? An acute onset or an acute increase in anxiety or an acute change in your level of anxiety is often due to an external influence. It's rarely due just to HD progression, so that's really important. It's appropriate to evaluate for treatable or reversible causes. And, ta-da, as if I haven't said this enough, anxiety is treatable. Okay, bottom line. If you or your loved one is consistently feeling anxious or nervous, these feelings should be addressed. With or without HD, we are all entitled to anxiety. Some anxiety, as we've said already, is protective and is adaptive and is considered within normal limits, but not all anxiety is considered within normal limits. So you need to start with the basics, acknowledge your feelings. Step 2, talk about it, easier said than done often. And then the hardest, ask for help. That's where things get a little murky, right? Especially if you're a caregiver. It can be really hard to really acknowledge and admit that you need help. So let's talk about our treatment options. As I've said many, many times, we have treatment options. We have pharmacologic treatment options and non-pharmacologic therapies. It's important that we address coexisting psychiatric symptoms. As I've mentioned already, anxiety does not like to travel alone. It often travels with friends, like depression. There may be comorbid medical conditions that we need to address that are exacerbating the anxiety. We've already mentioned just a few potential exacerbating causes. We may need to modify environmental factors, and then we want, if we've done these things, we may need to, and we still have persistent anxiety, we may need to implement psychotherapy and pharmacotherapy. So, non-pharmacologic therapy. And I'm going to let Amber talk a little bit more about this, but I'll just go through this slide briefly. Have you guys heard of cognitive behavioral therapy, or CBT? Yeah, awesome. So CBT is short-term therapy, and it's derived from the principles of behavioral and cognitive psychology. CBT for most forms of anxiety disorders involves exposure to the feared stimuli, which ideally breaks a vicious cycle of avoidance behavior, and should really have individuals that are participating in CBT should leave feeling empowered that they have tools to handle their anxiety. And again, I'll let Amber elaborate a little bit later on CBT. Okay, so pharmacologic treatments. So we have, as I said, we have many medications to address the symptoms of HD, and we celebrate that, but we must be respectful of all medications and their potential side effects. And we must ensure that our patients are well informed of what the medications can and can't do, so that we want to set expectations appropriately, start low, go slow, as I said already. And know that really it's always trial and error in treating all the symptoms of HD. So that gets us back to really setting appropriate expectations. So the most common class of medications that we use to treat anxiety, as you probably all know, are the SSRIs, the selective serotonin reuptake inhibitors. Some folks joke and say they should be in the water supply already. I mean, what the heck? But we know that serotonin is an important neurotransmitter involved in anxiety, and so SSRIs can be incredibly beneficial. Just a couple of important points here. If you decide to start an SSRI, and let me give you some examples. So escitalopram is an SSRI. The brand name is Lexapro. Citalopram is Celexa. Sertraline is Zoloft. So if you've heard of any of those are SSRIs. If you decide to start an SSRI, it is not uncommon to have an increase in anxiety upon initiating the medication. What? That sounds strange. But yes, just to keep things exciting. So you may have a transient increase in your anxiety for about the first few days, maybe the first week. So hold on tight. If this gets back to setting expectations, if you know this is going to occur, then it can make it a little bit easier, I think, to make it through that first week. Now, not only will you potentially experience heightened anxiety for the first week, but wait, there's more. The true effect of the medication will likely not start working for at least a couple of weeks, possibly up to 4 or 6 weeks. So hold on tight and try to be patient. But hopefully after 4 to 6 weeks, and often the effect really, in HD in particular, folks can experience the benefit even after a couple of weeks. But once the medication starts working, my patients will report just feeling they're not in a euphoric state, they're not floating around with unicorns and rose-colored glasses, unfortunately, but just feeling lighter. Just the load isn't quite as heavy, and those day-to-day stressors that really made sort of functioning almost impossible due to anxiety are less pronounced. It's a little easier from day to day. There are other medications that are not SSRIs that we can sometimes use we'll sometimes use the side effects to our benefit. For example, mirtazapine is a medication that's very sedating and can cause weight gain, so if we need assistance in the sleep department and we need assistance with weight gain, then we may select mirtazapine. We may use neuroleptics. They're also called antipsychotics. The nice thing about neuroleptics is that they can also help us with suppressing chorea. So if we need to address a few different symptoms at once, then we prefer to use one medication for a few symptoms as opposed to several different medications for several different symptoms. Benzodiazepines, you've probably heard of benzodiazepines, so examples would be lorazepam, which is Ativan, or diazepam, which is Valium, are generally not recommended for long-term use. They can suppress anxiety, but it's sort of like putting a Band-Aid on your anxiety, so they're not great for long-term use. We can use, and often will use, benzodiazepines upon initiating maybe an SSRI, just to help us get through that first week, wait until the SSRI starts working, and then we'll remove the benzodiazepine. So, we talked briefly about CBT, cognitive behavioral therapy. That sounds great, that sounds awesome. But what if you don't have access to CBT? Because all of these recommendations, sound great on paper, and then there's reality. I live in Timbuktu. I don't have insurance. How in the world am I going to access cognitive behavioral therapy? Is there anything, that I can do from day to day just to minimize the madness, just to help with my anxiety, whether it's mild, moderate, or severe? So, what are 5 things that we do every day that we can, in theory, that we can control or modify? Is there anything that you can think of that we do every day that we could maybe work on to optimize our well-being? Amazing. Y'all are the best. Okay. So let's get back to the basics. Control the things we can control, okay? We eat, as you've already said, we sleep, we move, we breathe, and some of us think once in a while, right? So my 3 sons don't, but the rest of us probably do. So let's briefly talk about ways to improve or optimize each of these. Okay, this is my favorite slide. I use it every time I give a talk because that is me. That is my self-portrait. Sleep is priceless, right? And as I've mentioned already, folks with anxiety often don't sleep, and it's a vicious cycle. You're anxious because you can't sleep because you're anxious, and it's not pretty. So we know that sleep disturbance in HD in particular is very common. It's actually an underrepresented non-motor symptom, probably due to the anosognosia that occurs in HD. Anosognosia is just a lack of awareness or lack of insight into the severity of symptoms. So many individuals with HD will have, say, bothersome chorea or bothersome sleep disturbance, but they may not really appreciate the severity of their symptoms, and that's not uncommon in HD. We have found, and others, that if you really don't ask about it, our patients are not going to report that they are experiencing excessive daytime sleepiness or they're having a sleep disturbance. We know that HD can cause many symptoms, and sleep disorders are very common in HD. Often sleep fragmentation occurs, so frequent awakenings during the night. Changes on the sleep-wake cycle are very, very common. So many of my patients are nocturnal, and they will have a really tough time sleeping at night. They're up and awake and ready to party at night, and their care partner is not awake and alert and happy about that. And then they're snoozing during the day, and that's can be very problematic. And then, of course, there may be anxiety contributing to the insomnia. So what happens if we don't sleep? This is no surprise. We know this. We get more anxious. We get irritable. We have trouble with attention. We have trouble with thinking, logical thinking. So how can we improve sleep? Well, first, we can address comorbid symptoms. We can practice proper sleep hygiene, and we may need to implement pharmacologic treatments. We all know what proper sleep hygiene is. This is no surprise to any of you in here. Easier said than done for most of us. We really want to try to be as consistent as possible with our bedtime, our waking time. We want to try to avoid multiple naps throughout the day. It is okay to take a nap every day, but ideally it needs to be scheduled and it needs to be in the early afternoon and no longer than an hour. So it is okay to take a nap, but not naps all day throughout the day. And then maintain a balanced diet, relaxation training methods, which we're going to get to very soon. Again, more sleep hygiene. We know this. I am guilty of, we know we should limit our cell phone use prior to bedtime. That's much easier said than done. Sleeping in a cool, dark room is important. This is always a fun discussion that I have with my husband, my wonderful husband, who doesn't necessarily agree, but I usually win. I pull out this little slide. Cool, dark room, just quiet time, no bright lights, just a calm environment. Exercise in HD, we talked about moving. We know that exercise, the recommendations for exercise evolve as the disease progresses. So in early HD, aerobic activity is really important and beneficial. And it doesn't have to be anything fancy. It can be walking around your house, walking around your block, working in the yard. In kind of mid-stage HD, we may need some supervised gait training. Physical therapy is appropriate throughout all stages of HD. And then in more advanced HD, range of motion exercises are really important. Ideally, we want to really try for about 150 minutes of moderate intensity aerobic activity per week. And again, this doesn't have to be anything fancy. Just try tricking yourself into some exercise. Park your car a little farther away from the store just to get a few extra steps. Take the stairs if you can instead of the elevator. Wii tennis. I don't know if anyone plays Wii anymore, but that's just such an oldie but goodie. Is that still a thing? I mean, it's fantastic. We need to bring back Wii. Okay. But getting back to our little sleep hygiene slide, try not to perform excessive physical activity just prior to bedtime because that could be disruptive to your sleep. Healthy eating, again, we know all of this, but it's, I think, just a good reminder for us to talk through it. Try not to skip breakfast. Try to eat brain-healthy foods, which I have on the next slide. Try to avoid processed foods. We know all this. What are brain-healthy foods? Well, we really want to try to focus on foods that are rich in vitamin B12. Vitamin B12 is a vitamin that's very kind to the nervous system, important for the integrity of the nervous system, just something to think about if you're maybe a vegan or vegetarian. Make sure that you're getting enough B12 in your diet. We can check B12 levels if needed, if there's a concern. And there's actually some data that a Mediterranean diet may improve motor and cognitive function in HD, although more studies are needed. I'll mention in a moment a little bit more about the Mediterranean diet. So tips for healthy eating. We know that dysphagia or difficulty with swallowing can occur in HD, and so we really want to think about implementing speech therapy and safe swallow techniques earlier rather than later. Consider pursuing a swallow eval and really implement, like I said, safe swallow techniques. We know that HD can cause a lower than average body weight, and so it can be often tough for individuals with HD to kind of maintain their weight or gain weight. And so that can be fun because we get to eat and drink lots of treats with lots of calories, so all the good stuff to try to maintain our weight. The Mediterranean diet is, I mentioned already, there's a little bit of data to support the efficacy of the Mediterranean diet in HD. There's actually a good bit of data in Parkinson's disease surrounding the Mediterranean diet and potentially its neuromodulatory activity. The Mediterranean diet is generally high in plant foods. Olive oil is really the primary source of monounsaturated fat, lots of fish and seafood, and a low red meat consumption. So, movement and breathing. We know that research has shown that exercise, yoga, meditation, and Tai Chi actually can improve symptoms of depression and anxiety. So, I laugh, we have with my patients quite often because we'll have yet another study, positive study, evaluating the effects of exercise in Parkinson's disease, for example, and often we've had a few in Huntington's disease. And I'm like, do we really need another clinical trial to evaluate the efficacy of exercise? Don't we know that exercise is good for us? But yay, let's do it. It's important to pursue these studies and demonstrate that, yes, in fact, we have data to support exercise. We're not just saying exercise to exercise. There's actually data to support the efficacy and benefits of exercise. And there is research to show that shows that there are positive effects for depression, and that using yoga strategies and yoga can facilitate the treatment of anxiety disorders, particularly panic disorder. Mindfulness-based meditation has positive effects on depression, and its effects can last for up to 6 months. The effects are not quite as robust for anxiety, but if used as an adjunct therapy, mindfulness-based meditation can minimize anxiety. So I think this is where I'm going to pass it along to you, if that's okay. Do you want me to play it? Okay. So this is a video from, no. Let's see if it's going to work. I'll have to get out of my, okay, we'll circle back to our video. Stand by for takeoff. Okay, so I'm going to bring the one and only Amber up, not soon enough. Y'all are like, oh, finally. Amber's here to save the day. Thank you.
And she's going to come back for questions, so don't worry about that. So this is a little video you can search later, but it's talking about going for your dumb mental health walk. And there's a little song that can get stuck in your head that you're going on your dumb mental health walk. Okay, so we're going to do a mindfulness meditation, and I promise it won't hurt. So start by settling in and getting comfortable in your seat. And you can close your eyes if you feel comfortable, or keep them open and soften your gaze. I hear some of you already beginning to take some deep breaths, so do that. Take several long, slow, deep breaths. Breathe in fully and exhale fully. Breathe in through your nose and out through your nose or mouth. Allow your breath to find its own natural rhythm. Bring your full attention to noticing each in-breath as it enters your nostrils, travels down to your lungs, and causes your belly to expand. And notice each out-breath as your belly contracts and air moves up through the lungs, back up through the nostrils or mouth. Invite your full attention to flow with your breath. Notice how the inhale is different from the exhale. You may experience the air is cool as it enters your nose and warm as you exhale. As you turn more deeply inward, begin to let go of noises around you. If you're distracted by sounds in the room, simply notice them and bring your attention back to your breath. Simply breathe as you breathe, not striving to change anything about your breath. Don't try to control your breath in any way. Observe and accept your experience in this moment without judgment, paying attention to each inhale and exhale. If your mind wanders to thoughts, plans, or problems, simply notice your mind wandering. Watch the thought as it enters your awareness as neutrally as possible. Then practice letting go of the thought as if it were a leaf floating down to a stream. In your mind, place each thought that arises on a leaf and watch as it floats out of sight down the stream. Then bring your attention back to your own breath. Your breath is an anchor that you can return to over and over again when you become distracted by your thoughts. Notice when your mind has wandered. Observe the types of thoughts that hook or distract you. Noticing is the richest part of learning. With this knowledge, you can strengthen your ability to detach from thoughts and mindfully focus your awareness back to the qualities of your breath. Practice coming home to the breath with your full attention, watching the gentle rise of your stomach on the in-breath and the relaxing letting go on the out-breath. Allow yourself to be completely with your breath as it flows in and out. You may become distracted by pain or discomfort in the body, or twitching or itching sensations that draw your attention away from the breath. You may also notice feelings arising, perhaps sadness or happiness, frustration or contentment. Acknowledge whatever comes up, including thoughts or stories about your experience. Simply notice where your mind went without judging it, pushing it away, clinging to it, or wishing it were different, and simply refocus your mind and guide your attention back to your breath. Breathe in and breathe out. Follow the air all the way in and all the way out. Mindfully be present, moment by moment, with your breath. If the mind wanders away from your breath, just notice without judging it, be it a thought, emotion, or sensation that hooks your attention, and gently guide your awareness back to your breathing. As this practice comes to an end, slowly allow your attention to expand and notice your entire body, and then beyond your body to the room you're in. When you're ready, open your eyes and come back fully alert and awake. The breath is always with you as a refocusing tool to bring you back to the present moment. Set your intention to use this practice throughout your day and to help cultivate and strengthen attention. Do you feel different than before we started? Yeah. Did that feel too simple? Like maybe you could do it even without me? I think so. So what I like about this one is it's not telling you to do it a certain way, right? There's not a right way, there's not a wrong way. You don't have to breathe for a certain number of counts. You're just breathing. You're just being human. You're just being yourself. And if I want to be too social worky, I can say, and yourself is perfect as you are, with all of your flaws. So think about doing something like this. There are a ton of apps, more than this. A lot of them are free to begin, and then you have to pay more. This UCLA Mindful app is free, and it's full of information, and there's podcasts, and so you can learn a lot. It feels very accessible. The thing about mindfulness is it sounds very fancy, and it's not. It's really not. It's just tuning in. So give this a try, especially when you feel the anxiety in your body, right? So when you think about feeling anxious, and we say feeling because it is something we feel in our body, what are some of those physical symptoms that you experience? What's up? Tension? Where do you feel the tension? In your chest, in your shoulders, and your shoulders are at your ears. Okay. What else? Your stomach hurts. Yeah, sometimes, a kid especially will say, oh, my stomach hurts, and then there's actually not anything wrong. It's anxiety. So it's a mind-body connection, and that's what mindfulness addresses. And so you can think more about this and look into it. I'm aware that we have about 15 minutes, and I suspect that people will have questions, so I want to let Dr. Forsteming come back up, which she will willingly, and answer any questions that y'all have. Maybe the breathing exercise helped you focus. What questions do you have about anxiety? And this is, it's such a universal experience. It's the most common mental health disorder. And even if it's not, as Dr. Forsteming explained earlier, even if it's not to the level of disorder, it's something we experience all the time anyway, just part of being human. So it's very universal, whether you have HD or not. What questions do y'all have? Yes?
Do you have
I'm going to ask you to pause so I can repeat it back for the streaming people, the people that are watching at home. So the question is about what do you do when you feel anxiety as a response in a scenario, which this sounds like a sensory issue, like with the bright lights, and so, and situational. And so you don't necessarily need medication because it's not persistent, but what do? You can't close your eyes because that's not functional. We have to open our eyes. So I think the first thing is that you're aware of it, right? Like you've recognized, you're talking about it, that this is something difficult for you, right? This is where I think I would distinguish between an anxiety versus a sensory issue. So if it really is about the lights, I'm not sure that that falls under anxiety, because it really could just be that that's overstimulating for someone. What are your thoughts? Yeah. Yeah. That's what I was thinking, sunglasses. Yeah. Have you tried wearing sunglasses? Okay. Oh, okay. So you don't want to trip and fall with the sunglasses. Okay. So, I mean, maybe the sunglasses are something you put on when you're sitting and then you take it off, or a ball cap that has a brim so that you're a little bit shaded. And I think this is a great example of times where you really just need to like break down what exactly is happening and what are some creative ways. And don't you know that that's what everyone does with HD all the time, right? What other ideas do y'all have for this gentleman and the bright light? You have a suggestion? So she recommended using grounding techniques. So, one thing that I didn't say is, sometimes when you do meditation, it's helpful to put both feet on the ground instead of having your legs crossed and feel your connection with the earth. Sometimes when you're feeling anxious, we get that feeling where we're kind of floating off. And so getting, reconnected, and we can get you some more exercises that are grounding. There's, a very common one that people recommend with getting connected with your senses. So thinking of, the sights and the sounds and the taste and the smell, and that's a great grounding exercise. Go ahead.
Yeah, it's funny because I've heard that Johnny Depp has issues with sensitivity. He has actually disorder with sensitivity to light. So you always see him wear these blue shades.
Oh.
They're not very dark, but he's always with these blue shades because he has this disorder.
Thank you. I'm going to repeat that. So he said that Johnny Depp often wears blue glasses. There was someone else, like Ed McMahon or someone did that. So blue glasses. Oh, she has some to take on and off the glasses to protect her eyes. Love it. You're prepared. So they click on and off, and so that's great. Oh, and it protects you from migraines. Yeah. Go ahead, sir. Yes. So what happens if you live in very north in Alaska where there's light all the time? Sometimes it's important to make lifestyle changes. No? Okay. I don't know. I guess you can. Yeah. But like the blackout shade, okay. I don't know. So for you, you're saying there's too much light. Do you have the light sensitivity that we're talking about, or is it about the sleep?
This is for my adopted son. The problem is he has anxiety supposedly, but he has medication, but he doesn't take it.
Okay.
And he has a hard time sleeping sometimes, so he does take sleep medication on a regular basis. But the anxiety thing, he's a Marine, so they don't take medication.
I see. Okay, I'm going to repeat that. So he said his son lives in Alaska and has difficulty with sleep, and he has a medication for his anxiety, or is it a sleep medication? But he doesn't take it consistently. It's such a bummer that if you want it to work, you have to take it all the time. Like we have to be compliant. But sometimes people don't. And that might be because they're forgetting. If someone has HD and then it might be that we need to start implementing some reminders. So maybe that's an alarm, but it sounds to me like he's just not willing necessarily, or he feels he's not symptomatic. So, sometimes it's difficult as family members to let our people make their own bad choices, and all we can do sometimes is encourage folks to consider it. Sometimes getting someone with a voice of authority to say the same thing that you've been saying is helpful, and they'll listen. I mean, I feel like I'm guilty of that too, but it is difficult to see the people that we love, not feel better. Yeah. Sir? You had a question?
Bring up what happened to us. Anxiety.
Oh, anxiety, yeah, for,
The trip there. I used to like to travel, I love to travel, but it's been becoming a complete disaster for her and us.
yeah.
Long story short, we went a couple of different places and they canceled the bus, and it takes a long time for us to
Yeah, we
get
went,
any place without naming bus companies, but anyway.
I'm going to repeat all that for the folks that are watching, travel has become much more difficult for you.
yeah,
But I
right,
sat on a stifling hot bus outside of this hotel to tour. I don't care about the cost of it, but I had to stand up. And I have HD number 40, K41. And I was so hot in that bus and
Yeah.
miserable. And the lady driving the bus, she said I had to sit down, and I told her, I says, it was raining wet.
Oh,
right, so they should have taken it,
I just
right.
could not believe the way we've been treated here.
I'm so sorry, yeah.
But listen, I literally took my water bottle and sprayed it over my head and walked home.
Wow.
Yeah.
Yeah, so I'm going to share that. So just that you tried to take a bus tour here in New Orleans, and it was not ideal for you, and it was very hot, and you were trying to stand, and they didn't want you to.
I saw some gentleman on the news in a wheelchair trying to navigate the streets. You guys are 35 years behind we are in Wisconsin.
Yeah, and so now, so he's saying that it's not very accessible here. It's not very physically accessible, wheelchair friendly in New Orleans. And I'm really sorry. I think that,
Right.
yeah, there's
Like,
many.
We made a bus tour to,
I
and,
got kicked out of a Holiday Inn, rural
We were-
Nashville.
and North, and, Smoky Mountains and stuff, so it just.
I'm so sorry.
Yeah, it just seems like there's been roadblocks after roadblocks, and the way,
Yeah.
Because of a shower curtain, it wasn't, I didn't even
Yeah.
raise my voice. The lady kicked us out.
Oh, goodness. Yeah, so I mean, I think that this is in some ways something that I've heard from other people as well, is that it's difficult to travel when you have a disability. And it's difficult, like if you have HD and you are someone who needs routine, to get out of your routine. And I'm so sorry to hear that it's been difficult for y'all. We can talk afterwards and I can try to help you think through how to advocate. But I think that's part of also the burden that sometimes we deal with, is now you have everything going on with your Huntington's or other things in your life, and then now you have to advocate for yourself too. So, I mean, as social workers, that's part of what we do, so let us know and we can help you. But I'm sorry to hear that happened. So we have one last question. It's about time to get out of the room. Yes, go ahead.
You mentioned earlier, keeping the number of naps in moderation.
No, you did
Are
that.
there any specific, negative effects to having, too many naps throughout the day or something?
Great question. So the question was in relation to naps, because I mentioned earlier that ideally you want to try to just take one nap per day if you are in fact having trouble sleeping at night, to really consolidate your daytime sleep so that you can sleep at night. And the question was, is it kind of problematic to take multiple naps a day, to sort of take cap naps? And it's ideal to try to really consolidate the cat naps into one nap. But if the naps are relatively short with, no longer in total than with multiple naps not exceeding an hour, then it's probably okay. You certainly don't want to, or you want to try not to nap in the late afternoon, in the evening, because you really want to sort of train your brain that daytime is for waking, is for being awake and alert, and so you want wakefulness, promotion of that wakefulness during the day, and so it can. And the other thing that I didn't mention with all of these strategies that we've talked about, just be patient with yourself and be realistic. So if you're someone that naps all day, every day, you're not going to tomorrow start, okay, I remember First Deming said 1 hour, one nap a day, here we go, life is perfect. No, it's not that easy. So if you can maybe eliminate, if you're taking 5 naps a day, cut it back to 4 naps a day, and just try slowly but surely. The same is true for exercise. If you can do 5 minutes of exercise, I do 10 minutes, and I'm like, you know what, 10 minutes is better than 0, a few times a week. So if you can just start small and be very, very, kind to yourself, then that's fantastic because you're trying, and that's all we can all do, right, is just try. And so I just want to, I know we're finishing up here. I think I've said most of these things already. We want to, stay as active as possible, minimize excessive caffeine, minimize alcohol in excess that can disrupt our sleep and contribute to anxiety. Use these techniques. Try and download one of these apps. There are free apps out there, and they can be incredibly beneficial. Start low, go slow. Don't beat yourself up if you try it once and you don't circle back for a year. That's okay, you tried it once. And then, just do your best. And that's, like, as Amber said, channeling my inner Amber. Don't aim for perfection. We can't. None of us can control everything. Sometimes it feels like our world is falling apart at the seams, with or without HD. And just stop, acknowledge it, and recognize that, get back to the basics. Think about that slide. Control the things you can control. We cannot control everything, but just get back to the basics and control the things, do the best to control the things that you can control. So finally, anxiety is common in HD. In those with HD, it's common in those without HD. Anxiety is treatable with medications, with non-pharmacologic strategies. Anxiety can be effectively treated. We talked about the ways that we can modify things that we do every day to optimize our well-being and minimize our anxiety. I didn't talk about this earlier, just quickly. Apathy is very common in HD. Apathy is a lack of motivation, a lack of that get up and go, just feeling like, meh, I don't really care. That's very common in HD. It is not, folks that are apathetic are not lazy. They just don't feel that internal sense of motivation. And so that can make it really difficult. I can stand up here, Amber can stand up here, we can talk about all these great strategies, but then if you're apathetic, you're going to have a really tough time actually implementing these strategies. And so that's where our loved one, our fan club, our HD team and village come in and help us in getting past that anxiety and trying to implement these strategies. So like I said, please be patient with yourself, be patient with your loved ones. Take it one day at a time. That's true for all of us. Start small. Something is better than nothing. Don't forget to breathe, as Amber reminded us. And that's all. So thanks for having us.